Doing breastfeeding is important because it's not only good medical practice, it's good health policy. Well, it's good medical practice because both moms and babies just have better outcomes when they breastfeed. And it's good health policy because it's a great long-term investment in the long-term health of the population.
Breastfeeding is important to all of the United States. We know as we're thinking about improving the health of our nation and we want to save lives and improve our health, we know that if more babies were breastfed and if all babies actually reached the recommended level of breastfeeding, it would both save lives and save billions of dollars each year.
The recommendations from the American Academy of Pediatrics are that mothers should breastfeed exclusively for 6 months and then continue to breastfeed for at least a year and thereafter as long as mutually desired. Breastfeeding matters. We know from years of research that the health outcomes related to breastfeeding are enormous.
Ms. Adams, thanks so much for coming to your prenatal visit today. You have been doing fantastic for your first pregnancy. Your type 2 diabetes is well controlled. Your blood glucoses look phenomenal, and that's not always an easy task, so pat yourself on the back for that one. Your weight is exactly where we would expect it to be at this point in your pregnancy, and your blood pressures are well controlled. So you're doing a great job. Now, we will have to keep an eye on your blood sugars and your blood pressures as we progress through your pregnancy, just to make sure that they don't become more problematic toward the end.
Okay.
Do you have any other questions for me?
I think I'm good.
Now, you know we can talk about anything. It is your first pregnancy after all. No questions at all?
No?
Well, you know, the last time you were here, we did mention breastfeeding. Have you had a chance to think about that anymore?
Not really. No. I mean, is it really the best thing for the baby?
Well, absolutely. We strongly encourage our moms to breastfeed. There's so many great health benefits, both for moms and babies.
And how long would I have to do that for?
Ultimately, that would be up to you, but the recommendations are that you would exclusively breastfeed for 6 months and then continue on up to a year, maybe even more if that's what you're comfortable with.
But
A mother's mature milk begins to be produced about 3 days after she gives birth. Components of mature milk vary over the course of breastfeeding, but on average, mature milk contains 8 to 10 grams of protein per liter, and lipids make up between 40 and 55% of the total energy in human milk. Major minerals like calcium, phosphorus, and magnesium are tightly regulated in maternal serum. Electrolytes, including sodium, potassium, and chloride, are determined by an electrical potential gradient in the secretory cell. Trace elements like iron, copper, and zinc are present in very low concentrations and are understood to be influenced by maternal diet.